It is late. The house is completely still. You get up to grab a glass of water, and on your way through the hallway, you stop. There is your dog, curled up on their bed, and something about the way they are lying makes you pause for just a second. Maybe they are balled up tighter than usual, nose almost touching their tail, every limb pulled in as close to their belly as they can get. Maybe you notice they are sitting up with their chin resting on the edge of the sofa, like they drifted off in the middle of trying to stay awake. Or maybe, and this is the one that made an owner cry in my exam room last spring, you see your dog with their front legs stretched all the way forward, chest flat to the ground, and their entire back half still raised up in the air, the way they look when they want to play. Except no one invited them to play. They are just resting. And they keep coming back to that same position every single night. And here is what most loving dog owners do in that moment. They look at their dog, they feel that quiet, small pull of concern deep in their chest, and then they talk themselves out of it. They're just comfortable. That's just the way they sleep. They seem happy. My friends, I want to talk to you tonight about that quiet pull of concern. Because after years of practicing veterinary medicine, I can tell you with absolute certainty that the instinct dog owners feel when a sleep position looks slightly wrong is almost never paranoia. It is pattern recognition. A dog cannot walk up to you and say that something inside their chest is making it hard to breathe when they lie flat. They cannot tell you that there is a burning, deep pressure in their belly that gets slightly better when they stretch their front legs out on the floor. Dogs are wired by thousands of years of survival instinct to hide their pain. In the wild, showing weakness attracts predators. So even in your home, even safe and loved, a dog in pain will stay quiet. They will eat, they may wag their tail, they will carry on. But they cannot hide the way their body positions itself to cope with what is happening internally. And the sleeping positions they return to over and over are one of the most honest signals their body ever gives you. What breaks my heart is how many pet parents see these positions, feel that instinct, and dismiss it for weeks or months until something becomes impossible to ignore. The signs were always there. The sleep position was speaking the whole time. Sleep behavior and positioning is something I ask about in almost every exam because what a dog does when they think no one is watching tells me more than almost anything else. Today, we are doing a complete masterclass on the 5 specific sleeping positions and patterns that are veterinary red flags. Grab a notebook because by the end of this video, you are never going to look at your dog sleeping the same way again. Let's start with the position that is missed the most often, and the one I wish every dog owner in the world understood. Picture this. Your dog walks into the living room, circles once or twice, and instead of lying down on their side the way they normally would, they lower their chest and front legs to the floor while their rear end stays raised up in the air. Nose pointed forward, elbows down, back end up. It looks almost exactly like a play bow, the way a dog stretches before a game of fetch. During the day, surrounded by energy, it is adorable, but you are not playing fetch. You are sitting quietly on the couch, and your dog keeps doing this while trying to rest. They will hold that position for a minute, get up, circle, and go back to it, like they cannot find anything more comfortable. In veterinary medicine, we call this the pancreatic relief position, and when a dog seeks it out during rest, especially repeatedly, it almost always means there is abdominal pain. The organ most commonly responsible is the pancreas. Here is why this position gives relief and what that tells us about what is happening inside. The pancreas is a small, highly sensitive organ nestled just beneath the stomach in the upper left portion of your dog's abdomen. Its 2 jobs are producing digestive enzymes that break down food and releasing insulin to manage blood sugar. When the pancreas becomes inflamed, a condition called pancreatitis, those digestive enzymes that are supposed to stay inside the organ begin leaking outward. The pancreas starts digesting itself. If you have ever experienced a severe stomach cramp and pressed your hands into your belly and leaned forward because that position gave you even 5 seconds of relief, you understand exactly what your dog is doing. Lowering the chest and stretching the front legs away from the body pulls the abdominal wall slightly away from the inflamed organ. It creates just enough physical space, just enough reduction in pressure to make the pain marginally more bearable. Their body figured this out on its own because pain is an extraordinarily effective teacher. I had an owner bring in a 7-year-old Labrador named Chester last year. She said he had been acting weird for 3 days. When I pressed her on what weird meant, she said he kept doing that playbow thing, but nobody was playing. When I examined Chester's abdomen, he flinched sharply at gentle pressure near his midsection. Blood work came back with severely elevated pancreatic enzyme levels. He had acute pancreatitis from getting into fatty scraps at a backyard cookout. 3 days of silent internal inflammation. His only external communication was that position. When caught at that stage, Chester responded beautifully to IV fluid support and fasting. Had the owner waited another 2 or 3 days, we could have been looking at hemorrhagic pancreatitis, which carries a very serious prognosis. If you see your dog returning to this bowing rest position, especially combined with reduced appetite, any vomiting, or a hunched or tucked belly appearance, please call your veterinarian that same day. Do not wait to see if they feel better in the morning. But the prayer position is only one of 5 things I want you to understand. The next one is quieter, far less obvious, and it involves not just how your dog sleeps, but where they choose to sleep and whether they can lie flat at all. Think about where your dog sleeps right now: their bed, the couch, the floor of your bedroom. Now ask yourself, when did you last see them stretched completely out on their side in a deep, fully relaxed sleep? Because one of the earliest signs of a developing cardiac or respiratory problem in dogs is a change in sleep posture from flat and relaxed to upright or propped. Dogs with fluid accumulating around their lungs, a condition called pleural effusion, and dogs in the early stages of congestive heart failure physically cannot breathe comfortably when they lie flat. The moment they lower themselves to the ground, the fluid inside their chest shifts and presses against their lung tissue. It becomes harder to draw a full breath, so their body refuses, they sleep sitting up, they prop their chin on the armrest of the sofa, they come to lie down, lower halfway, and then quietly give up and go back to sitting or resting in a semi-upright sphinx position with their chest elevated. The medical term for this is orthopnea, and it is one of the most important clinical observations in all of veterinary cardiology. Think about it this way. Imagine someone placed a heavy, wet sponge directly over your lungs every time you tried to lie flat. The moment you sat up, someone removed it and you could breathe fully again. You would stop lying flat too. Your dog has worked out the exact same thing entirely on their own and has adapted their sleep posture accordingly. What makes this so easy to miss is that the rest of their behavior may look completely normal. They eat, they walk, they wag their tail. The cardiac issue is silent and slowly progressing. Congestive heart failure is one of the most common serious health conditions in dogs, particularly in Cavalier King Charles Spaniels, miniature Schnauzers, Dachshunds, and Doberman Pinschers. And the reason it claims so many dogs later than it should is not that the signs are invisible. It is that the signs are quiet: a changed sleep posture, a slightly faster breathing rate at rest, a reluctance to take the stairs they used to fly up. If your dog has quietly shifted away from full lateral sleep over the past several weeks, especially if they breathe slightly faster than they used to when resting, please book a cardiovascular evaluation with your veterinarian. An echocardiogram, which is an ultrasound of the heart, can detect early structural changes years before a crisis develops. Early cardiac medication has been shown in veterinary studies to meaningfully extend a dog's life and quality of life before heart failure advances. Now, here is the one that catches almost everyone off guard, because the dog does not look like they are sleeping in a strange position at all. The position changes constantly, all night long. A healthy dog cycles naturally through sleep phases, including deep slow-wave sleep and REM sleep. During genuine deep sleep, they stay settled. Their paws may twitch, you might hear small muffled sounds, but they stay down. A dog in chronic pain cannot do this. They lie down, and within 20 or 30 minutes, the pressure building in a joint or along their spine becomes unbearable in that position. So they get up, they circle, they lie back down. Sometimes they stand for a while and just look around, not because they want anything, but because every position they try eventually becomes its own source of discomfort. This constant sleep-interrupted repositioning is one of the most reliable indicators of musculoskeletal or spinal pain in dogs. Intervertebral disc disease, commonly called IVDD, occurs when the cushioning discs between the vertebrae of the spine herniate or bulge inward, pressing on the spinal cord and the nerve roots branching off it. The pain is intensely positional. Dachshunds, beagles, basset hounds, and corgis are genetically predisposed to this condition due to their long spines and short legs, but it is by no means limited to those breeds. Osteoarthritis in the hips, elbows, and knees creates similar restlessness, particularly in larger breeds and senior dogs. The tragedy of chronic sleep restlessness in dogs is that owners frequently attribute it to anxiety, a restless personality, or just being a light sleeper. It may take months before anyone connects the broken sleep to the pain driving it. If your middle-aged or senior dog has changed from a sound, settled sleeper to one who shifts constantly through the night, that change is meaningful and deserves a physical examination, including joint palpation and possibly spinal imaging, to find out why. Here is one more that I promise you have never thought to connect to internal pain. Watch where your dog chooses to sleep. Not just how, every dog has a preferred spot, their bed, the corner of your room, a particular cushion they have claimed as their own. So what does it mean when a dog who has slept in the same comfortable spot for years suddenly abandons it and starts seeking out the kitchen tile, pressing against the wall, lying on the cold hardwood floor even when their bed is right there? A dog who consistently migrates to cold, hard surfaces is most often running a fever. Normal canine body temperature sits between 101 and 102.5 degrees Fahrenheit. When an internal infection, an inflammatory condition, or certain immune-mediated diseases push that temperature above 103 or 104 degrees, the dog is burning internally. Their bed, which used to feel comforting and warm, now feels like a heat trap. The cold tile is the only relief available to them. They are not being strange, they are thermoregulating in the only way they can. Fever in dogs is almost never the problem itself. It is the body's alarm system telling you that something deeper is wrong. Bacterial infections, including urinary tract infections and pyometra, which is a dangerous uterine infection in unspayed females, tick-borne diseases like Rocky Mountain spotted fever and ehrlichiosis, and certain immune-mediated inflammatory conditions, all present with fever and cold surface-seeking behavior. A basic digital rectal thermometer, available at any pharmacy, can tell you within seconds whether your dog is running a temperature. Anything above 103 degrees Fahrenheit, on 2 readings taken an hour apart, is worth a same-day call to your veterinarian. And finally, there is one that looks the most like comfort of all 5, the tight curl. And the difference between a healthy curl and a pain curl can be found in 3 seconds with your hand. Dogs curl up when they are cold, when they feel vulnerable, and when they need to conserve body heat. A curl for warmth and comfort is loose. The dog's muscles are relaxed, their belly is soft. If you reach over and gently rest a hand on their side, they ease into the touch. But a dog curling to guard their abdomen is curling differently. The curl is tighter, more deliberate. Every leg is pulled as close to the belly as possible. The muscles along their sides and abdomen are slightly tense, not relaxed. When you gently rest your hand on their flank or near their belly, they stiffen, they pull tighter. Some will lift their head and give you a quiet warning, not from aggression, from protection of a painful area. Abdominal guarding in this position can indicate several conditions, some of which are genuine emergencies. Gastric dilatation and volvulus, commonly called bloat, is a life-threatening twisting of the stomach that can kill a dog within hours if untreated. It most commonly affects deep-chested large breeds like Great Danes, German Shepherds, Standard Poodles, and Weimaraners. Splenic masses, intestinal obstruction, and diseases affecting the liver or kidneys can all produce the same protective tight curl and belly guarding. If your dog's tight curl is accompanied by a distended or swollen-looking abdomen, unsuccessful attempts to vomit, or extreme restlessness and distress, this is an emergency and you need to get to a veterinary facility immediately. So where does that leave you right now, tonight, as a dog owner who is probably going to walk past their dog's bed differently after watching this? Here is your action plan. Step 1, start observing with intention. Before you go to sleep tonight, take 60 seconds and genuinely look at how your dog is positioned. Are they fully relaxed on their side? Are they upright? Are they in the prayer bow? Are they migrating to the floor? Just look. Without the filter of "they're probably fine," You do not need medical training. You need to be paying attention, and you already proved you have that skill by being here. Step 2, take 30 seconds of footage. The most underrated tool in veterinary medicine right now is a short phone video taken at home. Dogs frequently will not replicate unusual behavior during an exam. A 30-second clip of your dog's sleep posture, the position they return to repeatedly, the restless repositioning through the night, gives your veterinarian diagnostic information that changes the entire direction of the examination. Start filming when something looks off. Step 3, trust the pull of concern. The instinct you feel when a position looks slightly wrong is almost never anxiety projecting onto your dog. It is observation. Give yourself permission to take it seriously. Step 4, give every meaningful change a 2-week window of attention before dismissing it. If your dog has changed their sleep position, their preferred sleep surface, or their ability to stay settled through the night over the past 2 to 4 weeks, that change has a cause. A brief exam with your veterinarian may be one of the most important appointments you ever make for your dog's long-term health. Paying this kind of attention to your dog is one of the most profound things you can do for them. They spend their lives looking out for you. The least we can do is learn to read what they cannot say out loud. Give your dog a long, gentle scratch behind the ears tonight. Watch how they settle. Notice the position they choose, and if something in you says it looks a little off, please, for their sake, trust that feeling. If this video opened your eyes to something you had not considered before, please hit that like button for me. It helps this kind of genuine veterinary education reach the dog owners who need it most. Hit subscribe so you never miss a video, and leave me a comment right now. Have you ever noticed your dog sleeping in a position that looked a little strange to you? Tell me exactly what it looked like. I read every comment, and your observation might just become our next deep dive. Stay safe, take care of your best friend, and I will see you in the very next video.